Welcome to Infection Prevention and Control Training. Today, there are several things we want to do. First of all, we want to go through the whole concept of chain of infection. How is infection spread? And we also want to understand what are some of the principles we need to remember to prevent the spread of infection. Of course, it is important to learn some techniques that we can use. And of course, there are several control measures we can put in place, again, with the view to break the chain of infection. Once we understand how we can break the chain of infection, we then want to be able to recognize what is our risk, because once you recognize your risk, then you can put certain things in place. So let's talk about the chain of infection. What is this chain of infection? Just imagine that you have a chain around your neck, and you recognize that there are links, and the links have to be connected in order for that chain to stay in your neck. So when we talk about the chain of infection, we're talking about certain things. So first of all, one of the links in this chain is there must be an infectious agent. So what is an infectious agent? It may be a parasite, it may be a bacteria, it could be a virus. Once this organism can cause disease, it's known as an infectious agent. But in order for that infectious agent to cause problems, there must be what we call a reservoir, something that will allow that infectious agent to grow and multiply. In most cases, it may be an animal, or it may be you and me. So we provide the environment that the bacteria or the virus can increase. Once that agent has increased in numbers, it needs to get out. So there needs to be what we call portal of exit. How would it get out of the human form? So just think of it. How does anything get out of us? So think of our nose, our mouth, anywhere where we have an orifice, that's where it's going to get out, portal of exit. Then once it's able to get out, there must be what we call mode of transmission, a system that will allow that organism to get to somebody else or somewhere else. So we talk about contact. When we talk about contact, we're thinking about touching. We also talk about maybe it's done through droplets or it's in the ear. And we'll touch a bit more on those things as we get a little further along. So we have 4 links in the chain so far. We talked about infectious agent, we talked about a reservoir, we talked about port of exit, and then we said, oh, there must be a mode of transmission. So what else do we need to have in that chain? So there, you've gotten out, you know how you're going to get to point A to point B, but you have to get the portal of entry. How does it get into person A and get out of person A, and get into person B? And that's when we need the link portal of entry. So think about it. Your skin is one of the best barriers that you could ever have to prevent entry of anything. But imagine you have a cut and it's open, so that can be a portal of entry. Or if you had time, you went and look in the mirror, and you look in your eyes, you see these pink, nice-looking things. That's your mucous membranes. That is how the organism can get into your body's system. But even though it has been able to enter into your system, there must be certain conditions to allow that organism to continue to grow. And that's when we talk about susceptible hosts. This particular link talks about your immune system. Is your immune system strong enough to manage that organism and in most cases kill it? Or has it been weakened by diabetes or some other illness which makes you more susceptible to disease? So those are the links in our chain: infectious agent, a reservoir, portal of exit, mode of transmission, portal of entry, susceptible host. And once all of these links are able to come together, that is when disease occurs. So the object of infection prevention and control is to break that link at any point. Maybe it's to get rid of the infectious agent. So let's think about it. How would I get rid of bacteria? Have you ever had a urinary tract infection and you just had to get to your doctor? What did the doctor give you? Think about it. He gave you medication. He gave you antibiotics. And once those antibiotics started to work, of course, the role of those antibiotics is to kill the bacteria. And once the bacteria has died, you have broken the chain. There's nothing there to cause infection. Or maybe It's to protect the break it at the port of exit. So how would we do that? Maybe you have a cough or sneeze, so you try to contain that cough or sneeze so it's not able to exit. Port of entry. Remember we talked about having a cut on your skin? So the best thing to do is to block that entry, is to cover that cut. And of course, the link acts to set to host, making your body strong enough to withstand any infection that may occur. That means eating your veggies. Some of us don't like to eat your veggies, but broccoli is a really good source of vitamin C. So let's talk a bit more about the modes of transmission, because you recognize that when we are able to understand how an organism is able to travel from person A to person B, and we put certain things in place, then we, again, can break that chain of infection. So we talked about contact being one type of mode of transmission. And what do I mean by contact? So contact can be direct or indirect. So let me give you an example. Suppose you're just having a good time, and all of a sudden something just caused you to feel as if you want to sneeze. So you had no time to reach for tissue at all, and the sneeze just came. And unfortunately, your friend just came along that you haven't seen in a long time, and without thinking, you just grasp that person's hands and give them a handshake. So what have you done? There has just been direct contact. And if you had a cold or some other problem, when you sneeze, you have transferred it to your hands. And then by touching the other person, you have basically, through contact, passed on whatever it is that you had. And unfortunately, the person doesn't wash their hands, doesn't use wipes, and sometime later, they forget all about the fact that they gave you a handshake, and then they take their hands, the eye begins to itch, and they start to rub their eyes. Remember I talked about mucous membranes? So here we have it, through direct contact, it's on the person's hands, and then they start to rub their eyes, and they have just transferred whatever organism they received from the other person into their eyes. So that's how the chain has been connected. So our idea is, if we know about the contact, then we put things in place to break it at that point. So let's give an example of indirect contact. So direct contact is contact between person A and B. And we give the example of touching. It could be kissing. Those are examples of direct contact. With indirect contact, what happens is that maybe I sneezed, and then I touched something like the phone. And then somebody came along later and used the same phone that I touched, because the phone has not been cleaned. And as they touch the phone then acts as what we call a fomite, because the organism is on the phone, and I've picked up that organism through touching the phone. So that's the example of indirect contact. So we also hear about droplet transmission. So what are droplets? I don't know if you've ever realized, sometimes you're just chatting with a friend, and all of a sudden you see these magnificent droplets fly from their mouth, or you have a sneeze. Imagine you having a sneeze, and you were able to take a picture of the sneeze. You'll see all of the droplets from that sneeze. So these are particles which are fairly large, which can be seen, and generally they drop about 1 meter away from you. And usually, if you're close enough, whilst these droplets are being produced, they can land on your mucous membranes, whether it's your eyes, your mouth, your nose, and there we have it, transmission of organisms if they can be found in the droplets that are produced. So the third mode of transmission we want to talk about is airborne. And usually airborne, these are smaller particles, we can't see them, and because they're so small, the air can take them and carry them a little further than they would the droplets. And again, these airborne particles can land on our mucous membranes, and that's how the organism is passed on from person A to person B. So we now have an understanding of, one, the chain of infection, and we've gone through the modes of transmission. So what is it that we're trying to do? As we said, we're trying to break the chain. If we understand how our organism behaves and how we can break the chain, then it means we can stop infection from passing from person A to person B. And there are several things that we can do. When we look around that chain, we talked about it with the infectious agent. First of all, know what it is, and we may have actually have medication that we can actually get rid of it. If it's the source, then there are things that we can do to make sure that we reduce the organism in that source. For example, if it's in water, it can be found in water, things that we do presently for our water, we might put chlorine in our water to get rid of any organism that might cause infection. For modes of transmission, one of the most important things that we can do is the use of hand hygiene. Washing our hands, simple soap and water, excellent way of breaking the chain. Or another thing that's very important that we take for granted is the cleaning of our surfaces. Environmentally important things that we can use to wipe our surfaces, again, to get rid of the bacteria. And if it's the port of entry, we talked about covering the area. And of course, very important, again, is hand washing. And we already spoke about how do we improve our immune system so that we're able to defend against these organisms. So we have a very basic understanding of how we can break the chain of infection and what are the things that we can do to make sure that we protect person A and person B. So something that I want to talk to you about is hand hygiene. We take this for granted. We only remember that we have to wash our hands when we realize there is no water and there is no soap. And sometimes we're so busy caught up in our jobs that we don't take time to pause and wash our hands. But we're saying that hand hygiene is one of the most important and effective things that you can do to break that chain. So let's talk about our hands. Do you know that you have what we call resident skin flora? Resident means they are supposed to be there. Yes, we walk around with bacteria every day. We need them. And the thing is, with resident skin flora, when we wash our hands, they're not easily removed because they have a protective factor. However, unfortunately, if we have any broken skin, they can cause infection. So along with the resident skin flora, we have what we call transient skin flora. And these are the things or organisms that we want to get off of our hands because these are the ones that can cause infection. And usually they're mostly found on the tips of our fingers, and they're easily removed by the hand hygiene technique. Now I'm going to invite a colleague to show you, to go through with us the hand hygiene technique, but there's some things I want to say to you before we get there. Now in healthcare, we talk about 5 moments for hand hygiene. Before touching a patient, before clean or aseptic procedure, after body fluid or exposure risk, after touching a patient, and after leaving the patient's environment. So we're aware, before we go in, we're washing our hands. As we interact, we are washing our hands at every opportunity. Maybe we've had an accident where there was vomitus or there's some other fluid that was released and we came in contact with that. Again, washing our hands is important. And then after you touch the patient, wash your hands or engage in hand hygiene. And when you leave that environment, that's a great opportunity again to clean your hands. And whether you're in healthcare, whether you're in a hospital or a clinic, or you're in the field, wherever you go, it's best practice to clean your hand before you enter an environment and clean after you leave that environment, and even whilst you're there in that environment. Now, in order to go through the procedure of correct hand hygiene, there's some things you need to remember with regards to your hands. So first of all, in healthcare, we advise all workers to keep their nails at a certain length. If they're too long, or if you're used to wearing acrylic nails, it means that the bacteria can get underneath your nails, and your nails become what we call fomites. So of course, we're going to make sure that our nails are cut to the appropriate length. Again, if you wear any jewelry, maybe rings, or you have a watch, you want to remove those things so that they're not on your hands because we don't want them to be fomites. In addition, if you have any cuts or bruises, you want to cover those areas for protection. If you're wearing long sleeves, you want to roll those sleeves up because we don't want the sleeves to get into the way once you're going through the procedure of washing your hands. And it's important that we go through this because many times you wash your hands and we miss a lot of areas on your hands. We tend to miss the tips of our fingers, and we were told that most of the transient bacteria is found at the tip of the fingers. We tend to miss our thumbs. Although they're one of the bigger fingers that we have, we tend to miss our thumbs. We miss parts of the palm, and we miss part of the back of our hands. So in our technique, we're trying to cover all areas so that we don't miss any of the transient bacteria. So what are the basic things you need to wash your hands if you're doing soap and water? First of all, you need to have a sink. There needs to be water, and it doesn't have to be warm water. Cold water would also do the job. And it's appropriate that you have paper towels or something that you can turn the tap off when you're finished with your procedure. Your choice of soap is important as well. So you're trying to avoid bar soap or solid soap. Because think of it, if I come and use a bar soap, and leave the bar soap, then person B comes and uses that soap. Person C will get the germs that person A had on their hands, and person B. So we're using liquid soap because that soap is not reused. And it does not have to be antibacterial soap. It just has to be simple water and liquid soap, and that will do the job. However, if you don't have soap and water, and your hands are not visibly soiled with anything organic, you can use your alcohol-based hand rub. Of course, you need to check your labels. And what is it you're checking? You're making sure that the amount of alcohol in that hand rub is at least 60%, because the alcohol is the active ingredient. What the alcohol does is to dry out the organisms and cause death of the bacteria or of the virus, and that's why you need to have that amount of alcohol in the hand rub. Make sure that you dry your hands appropriately, when you're using soap and water, and when you're using the hand rub, you rub until it's all evaporated and dry. And make sure that you have some sort of emollient, something that will keep the hands moist, because if your hands are dry and chapped, it increases your risk of getting infection. So let's go through the steps of using the hand rub. And you should be able to see on the slides the directions, but we're going to demonstrate the sequence of using the hand rub. So first of all, we've checked our hand rub. We know that it has at least 60% alcohol.
This was actually 70%.
Even better.
That's good.
And what we're going to do, we're going to place in the palm of one hand the amount similar to the size of $1. So once we've done that, we're going to rub our palms together vigorously, and that's trying to spread the gel. And then we're going to target the back of both hands, first between the fingers on one side, and then repeat that on the other side. Once we've done that, we're going to cup our fingers together, and we're targeting under the fingernails to attack any organisms or dirt that's under the fingernails. Once we've done that, we're going to then focus on our thumbs. Remember, we tend to miss our thumbs quite a bit. And again, the idea is as you rub in that action, that's lifting off any bacteria or any viruses that may be found on your hands, and we're going to make sure that we cover all areas and rub until it is all dry. And usually if you're doing this procedure, it should take about 20 seconds. So we're still talking about how can we break this chain of infection. We learned how to go through the correct procedure to clean our hands, but there are other precautions that we can put in place based on the modes of transmission. Remember we said modes of transmission include contact, direct or indirect, droplet, or airborne. So our precautions are based on these transmission modes. But we have something as we call it, standard precautions. Every time you're in a situation, whether health or otherwise, there are standard things that you need to do to protect yourself and to break that chain. All levels of precaution, whether it's standard or transmission-based precautions, hand hygiene is very important. And other examples of standard precautions include respiratory hygiene. What does that entail? So if you're going to cough, you cough in your elbows, and you should have tissue that you can again cover your sneeze and cough, and it must be disposed in the appropriate receptacle. Safe waste management, how do you discard of your waste, whether it's medical waste or normal waste? What is the procedure? Where does it go? Again, important is that we try to avoid all bodily fluids by wearing the appropriate PPE. And of course, cleaning and disinfection are important things to remember as part of the process of standard precautions. So let's go on to transmission-based precautions. So the first one we want to talk about is contact precautions. And generally, with this level of precaution, everyone must clean their hands, including before entering and when leaving the area or room. Persons must wear gloves. They should also put on a gown before room entry and discard of this gown before they exit the room. If you are going to be using any sort of equipment, whether stethoscope or any other implement, they must be disposed of if they're disposable or placed in containers where they can be processed for use in the future. If we're talking about droplet precautions, what we're trying to achieve is to provide barriers, because remember we said droplets are these large particles that travel about a meter away from us. And with this, again, hand hygiene is important before entering and when leaving. And with this, we want to add covering for our mouth and our eyes as barriers. When we go up to airborne precautions, this is the highest level of precautions, and that is when we add what we call a particulate respirator, where this respirator can provide barrier to particles which are fairly small. You might have heard of the N95 particulate mask, and all that is saying is that mask can block 95% of the particles, small particles, that your face may come in contact with. Generally, we say to persons, if you are on airborne precautions, you remove that mask after you've left the room where you have been providing care. Again, hand hygiene is very important. So at this point, we want to talk a little bit about the virus that's causing everyone to be a little concerned, very much concerned, I should say, and that is the coronavirus. So the coronavirus, the family of coronaviruses, is a very large family. So this is not the first coronavirus that has been around. We know that the coronavirus has been implicated in the cause of MERS, Middle East Respiratory Syndrome, and SARS, Severe Acute Respiratory Syndrome. However, this particular virus is what we call a novel virus, which has not been seen before, but it is within a known family. We would have first heard about this particular virus in December of 2019, when China reported that in the Wuhan city, Hubei province of China, there were a number of persons who were diagnosed with pneumonia of an unknown cause. By the 9th of January 2020, the Chinese authorities had reported that this pneumonia was being caused by a new variety of coronavirus. And by the 30th of January 2020, the World Health Organization declared the outbreak of 2019 nCoV as a public health emergency of international concern. So it meant that all countries had to make sure that they had plans in place to deal with the spread of COVID-19. So how is COVID-19 spread? And I'm sure you would have been listening to your radio, or you've been watched some documentary or some newsreel that would have told you a little bit about COVID-19. It is spread by respiratory secretions, droplets, aerosols, which contain the virus. And this is usually produced when an infected person coughs or sneezes. Directly transferred from the mouth and noses of persons who may be in close contact with these individuals, that is within 2 meters. Or, as we discussed before, by touching surfaces where the products of the sneeze or cough has been left behind. And then, unfortunately, we don't engage in hand hygiene, so we touch our face, and it's transferred through our mouth and our nose and our eyes. So in terms of precautions we need to put in place for this particular virus, we talk about standard precautions, contact, and droplets. And if you're in a situation where you're creating aerosols, then we have to apply airborne precautions. What is the focus of countries trying to manage, or as we say, contain the spread of COVID-19? First of all, you need to be able to identify those who may have infection because of COVID-19. Once you've identified those persons, then, as you would have heard, that person has to be isolated from other persons who are well. And of course, we need to find out who are the persons that this particular individual might have come in contact with, and that's what we call contact tracing. Research has shown when we vigorously contact trace persons who might have been exposed to ill persons with COVID-19, that helps us to, as we say, flatten the curve. And all we're saying is that we tend to reduce the spread of the infection so quickly. When we look at other countries around the world, we see massive peaks when we look at their curve because it has spread so quickly, it has overwhelmed the healthcare system. So the idea is, if we can slow down the spread, then our healthcare system will not be overwhelmed. So what are the things that we're using to help us to identify, isolate, and contact trace? We use what we call case definitions, things that help us to identify someone who may possibly have COVID-19. And we also do testing. So if someone who has had a test is positive, whether they're presently showing after the fact signs and symptoms, they're seen as a confirmed case of COVID-19 disease. Simple things that we can do to break that chain or to slow down the spread is to cover your coughs and sneezes, wash your hands for at least 20 seconds, and avoid touching your face. We also hear the term social distancing. Preferably we like to say physical distancing, meaning we avoid handshakes or hugs because we don't want to transmit disease through contact. We keep our distance, and presently we're advised to stay at least 6 feet or more away from each other. Many persons are working remotely so that there's no congregation in work areas, and we are avoiding mass gatherings, meaning we're not coming together for celebrations or sporting events because, again, we want to keep that distance between us to reduce the spread of disease. We are breaking the chain. We are advised to stay at home because, again, that helps to provide physical distancing. And we must engage in washing your hands. So I just want to, for a while, very briefly, talk about isolation versus quarantine, because sometimes we tend to get those two terms mixed up. So isolation and quarantine help protect the public by preventing exposure to people who have or may have COVID-19 disease. So isolation separates sick people with COVID-19 disease from people who are not sick. So when you hear isolation, think, oh, this person is sick, and we're keeping them away from persons who are not sick. When we talk about quarantine, this separates and restricts the movement of persons who are exposed to COVID-19 to see if they become sick. So when you're told you're in quarantine, you're not sick, but we'll be monitoring you for at least 14 days to see if you develop symptoms. And if you develop symptoms, then you go into isolation because you're now sick. And generally, if someone is in isolation, especially in the healthcare setting, there are certain things that have been in place. Again, we're trying to break that chain. So they have a separate room, dedicated equipment in that room, and of course, healthcare workers will put on the full PPE, which you will see later what is the process of putting on and taking off PPE. So I think by now you have a good understanding of how we're applying the principles of infection prevention and control. And we talked about the important things that we need to have in place to contain the spread of COVID-19. But an individual responsibility is, for all of us, is that we must manage our immune systems. Let's talk a little bit about how does the immune system help us to stop disease. So we know there's exposure. There may be someone who's coughing and sneezing, and you may be too close to them. And unfortunately, the virus has been able to enter your body. But what happens is that you go through what we call an incubation period. We know for COVID-19, the incubation period, that is the time that the organism has to develop in your system and interact with your immune system before symptoms start to show, is 2 to 14 days. On average, person might start to show symptoms at least 5 to 7 days. In some persons, there will be no illness. Why? Because your immune system is strong enough to just get rid of that virus before it causes you to have signs and symptoms. And therefore, the infection is cleared, and there's no transmission of the virus to anybody else because your immune system has done the job. In some persons, however, you may have what we call colonization, where they don't get sick, but they're able to transmit. And that's why it's important that we maintain our physical distancing, because the person looks pretty well, but unfortunately they can spread the virus. There are some persons who will be ill, and that might range from very mild symptoms to very severe symptoms. And we know there are persons who may have to get ventilation because the virus has affected their system so much, and that person is able to spread the virus, and that's what we call symptomatic transmission. So with this particular disease, most person, or 80% of the persons who get ill, will recover without any complications. About 1 in 6 persons may become seriously ill and develop difficulty breathing. We know with this particular virus, from reports coming out so far, that the elderly are at risk for this particular virus, more so than the younger persons. Not saying that younger persons will not get sick or may develop serious disease, but most of the persons who have died have been in the older category. And usually that's around 2% of persons who have been affected by the COVID-19 disease may die. So the important message I want to share with you is that you need to manage your immune system. How do you do that? You have to look at your lifestyle. What is it that you're doing to take care of your immune system? Washing your hands is important. Breaking that chain. Making sure you keep your surroundings clean. Again, dispose of your garbage appropriately. Have good ventilation, because again, that helps to get rid of other things in the air. Exercise is important because that helps to boost your immune system. When you look at what you're eating, are you using a lot of vegetables, things that will help to boost your immune system? All the colors of the rainbow, your reds, your blues, your oranges, your purples. Of course, good sleep is important, and you try to avoid sharing utensils. So in a situation where you are a healthcare worker and you have been exposed to someone who may have had COVID-19, there are certain things that have been put in place. We usually ask our healthcare workers to monitor for any fever twice daily for 14 days after exposure. And of course, if there are any symptoms that develop, they must consult their general practitioner. This person, once they're sick, should be isolated. And of course, as you said before, there will be contact tracing of any person who may have come in contact with that person who is suspected to have COVID-19. So I just want to now skip to the thought of how do you assess your risk, whether you're in a healthcare facility or you're on the street. What is it that you need to do to assess your risk? So first of all, when we're looking at risk, there are 3 things I want you to think about. First of all, spot the hazard. What is the hazard? Someone coughing or sneezing. Once you've spotted the hazard, assess the risk. So how do I assess my risk? How close am I to that person? What protections are there in place from the cough or the sneeze? And then control the risk. What is it that I can do to control that risk? And that is where I want to introduce the concept of hierarchy of controls. I know everybody's caught up with, oh, you must wear a mask, you must do this and do that, but listen to me. One of your best protections is your brain, thinking about what's happening, looking at your risk, and putting things in place. So I have on my slides a diagram that says to me that PPE is important in terms of hierarchy of controls. It's at the bottom. It's easier to implement, but it's the less effective. So if you just have PPE and there are no other controls in place, it's not going to totally protect you. So other things you can do is administrative controls, engineering controls. At the top, we have elimination. But we know that we can't eliminate the virus presently, and we can't substitute. So the next thing we can do is put engineering controls. And all we're doing is that we're looking at our workspace, or we're looking at how we do things, and we're making changes. So here's an example. Previously, your workplace might have had taps where you had to actually turn the tap on. Maybe they have some money. So now they can put within the workplace some taps that you just press your foot, and voila, the water is on. You don't have to touch the tap at all. So that's an engineering control. Maybe you change the way how you do things, the process. Instead of taking things from people, you may ask persons to place things, do things online, so that you don't have to touch their forms or other things that may cause you to come in contact. So those are things that you can change in how you do things that would protect you. Then we go to our administrative controls. What are these administrative controls? And all that is that first of all, you must have a plan. What is my contingency plan for interacting with the public or for doing certain things? Again, you have to ask yourself, do I have the things in place to source the necessary equipment to make my staff safe? Do I have an area that if I do have PPE, where they will put on this PPE, and once they have utilized the PPE, personal protective equipment, where do they discard of the PPE? How do I get rid of the waste after we've done what we're supposed to do? So these are things that persons have to think about in making sure that you are controlling the risk that you may be exposed to. So just a quick reminder, COVID-19 symptoms: fever, cough, difficulty breathing, and some persons may have severe illness. And we note that there are certain persons who are more at risk of getting COVID-19. At the top of the list will be persons who are healthcare workers, because you may be interacting with persons who are ill, and the persons that you see may not be aware that they have COVID-19. So you treat everyone that you're in contact with as if they had COVID-19. Close contacts of persons with COVID-19, especially if you're in a family situation, you're at higher risk. And once there's community spread where there are lots of persons who have COVID-19, again, your risk will increase based on the number of persons who have the COVID-19 virus. So important to know that travel to areas where there was COVID-19 spread was one of the bigger risks previously. So in terms of your risk assessment, these are some of the things I want you to think about. Remember that transmission of COVID-19 increases if, one, there's close contact, so we're talking about proximity less than 1 meter away, direct contact with infected patients, and then there's self-contamination, indirect contact with surfaces or objects contaminated with the virus, then self-contamination, and that's why we keep stressing hand washing. That's why we keep stressing the physical distancing. And if you're in the healthcare arena, an aerosol generating procedure, maybe you're taking a swab or you're suctioning the person, these are all things that increases your risk of actually contracting COVID-19 disease. So here are some practical things that you can think about. Again, we're looking at risk assessment. So if you're walking by or briefly in the same room with a person tested positive for COVID-19, who was experiencing symptoms of fever or cough, you didn't go very close to that person, then your risk is very minimal. But consider this. If you're living, as I said before, in a household with someone who's a confirmed case, and you're not engaging in the methods that I spoke about before, them having their own room, having their own utensils, again, your risk is very high. So obviously, if you're engaging in the physical distancing and following the hand hygiene and other things, your risk is very much decreased. In the healthcare setting, We consider a healthcare worker to be at high risk, especially if they are performing or are present in a room for aerosol-generating procedures with unprotected eyes, nose, or mouth. And we usually say to those persons, you need to have daily symptom monitoring, make sure you don't develop any fever, any cough, or respiratory symptoms, and generally, the person should be excluded from the workplace for at least 14 days. Low risk is considered healthcare worker using appropriate PPE during patient care and who have had very brief interaction with the case. But we're still saying to you, there should be self-monitoring for symptoms, and there doesn't need to be any work exclusion because we consider the situation to be of low risk. But if you look at the slide, you'll see for each interaction, each level of risk, there are certain public health actions that need to be taken. So one thing I want you to do, even as you're looking at this presentation, is to ask yourself, where do I stand in terms of my occupational risk? Is it low? Is it medium, high, or very high? Even if you consider yourself to be at low risk, there still must be a level of caution that must be implemented in your workplace. And that is when we now come to the use of PPE. Important to note that PPE, as I said before, is not the answer, the first answer that you need to consider. You need to consider all other things. Make an assessment of what is your risk, and of course, choose the appropriate PPE. And each type of PPE has a particular use. In choosing your PPE, there are certain things you must consider. First of all, what is the type of exposure that you anticipate? Will there be splash or spray versus touch? What category of procedure of precautions are in place? Is it contact, droplet, or airborne? You must also think about the PPE in terms of how long will you be engaged in this task. Will the PPE be appropriate? Will it last long enough? And obviously, you need to make sure that your PPE will fit you, because if you have the wrong size, then it will not give you the protection that you need. We know gloves are used to protect our hands, gowns to protect our skin or clothing, masks and respirators protect our mouth, nose, goggles and face shields protect our face, our eyes. And if we were to look at the World Health Organization PPE recommendations, we see, based on the type of task, as this next slide will show, will determine what combination of PPE you need to use for a given activity you'll be engaged in. There are several things that we can put in place, but as I end this part of the presentation, I want to say to you, be aware of your surroundings. Be able to spot the hazard, be able to understand what is my level of risk, and of course, put the appropriate controls in place. But whatever you do, make sure that you take care of yourself and your family as you apply these basic principles of infection prevention and control. Thank you.